Good evening, everybody. I am here, board certified family and obesity medicine doctor, here to have a little fun this evening. We're going to talk a little about keto, rather what we say as a fact or fiction. And I have, guess what, another family doctor who's also board certified in obesity medicine, Dr. Kristin Baier, who's by my side. And we're going to talk a little bit about that. And we just did a podcast. As you know, I like doing a post-podcast show. I drag people with me to spend more time because I want you to get to know them and understand the things we're trying to teach. And it's really exciting to have who was once a Chicago native who moved out to California. And now she's spreading her message there, thankfully. And I appreciate you, Doctor, for not only teaching your patients, but just putting yourself out there, sharing a message of healing for people. Because I think a lot of people give up on healing because they think that nobody's actually showing them the path. So I think we both have stories to tell, but I'm curious for my audience if you could just share, how you ended up, getting into this whole dietary approach to healing. Food is medicine. So I want you to explain that so those who are listening will be able to kind of chime in. And by the way, before Doctor does that, when we get to the fact or fiction portion and we talk about the questions, I want you guys to chime in. And so I'll bring the question up and then I'll ask you, is this fact or fiction? Throw those into the comments, whether you think it's fact or fiction. We'll get your answers in. We'll laugh at you, make fun of you, and then we'll give you our opinion. It's just an opinion about what we think. So go ahead, Doc. Tell the audience how you got into this dietary space.
Great. Well, thank you for having me on here. We had fun recording your podcast. I'm glad to continue it. And my own journey, I was diagnosed with lupus when I was a medical school student, and that kind of sparked my interest to start finding alternative methods for treatments or cures besides traditional medications. So I've gone from vegan to paleo to keto to mostly carnivore at this time, but it was really trying to heal myself that led me down the path of food as medicine.
Yeah, I love it. And I think I did the same. I was having some issues with my hands. They were aching. I had some irritable bowel stuff, had a family member that was ill. And then we did our own little investigation and found that there were other ways to do this. So really excited to have you to, give your thoughts on these questions that we have. And I wanted to say hi to Francine and Jerry and Clayton, Holly, and Buke 49, which is their tag, and they're coming from Alabama, just saying hi to you. And they were able to enjoy the Perfect Human Diet Summit, which I spoke at, and they commented that they enjoyed that. And shout out to Dr. Ken Berry. And for those who hadn't listened to the podcast with him, we did a similar journey with him. So he's a great guy and we both love and respect him. So let's kind of get started. And again, as a person who's doing the live, go ahead and chime in. The first question that I'm going to ask you, fact or fiction, you can eat as much fat as you want. And as you know, if you do a keto diet, it's a high fat diet. So the question is, fact or fiction? Put those in the comments. Do you think it's fact that you eat as much fat as you want on keto, or do you have to kind of restrict your fat consumption to do it right? So just go ahead and throw some comments down there, and I'll give it 2 seconds, and then we'll provide some commentary as well. And one of the comments went from a SAD diet right to a carnivore diet on September 1st. So it's kind of a new start for that person, and I'm very excited for them that they're doing that. So let's go ahead. So go ahead, Dr. Baier, tell me your thoughts on fat. If you're on a keto diet, what's your thoughts on, what should you do with that reality? Should you limit it? And one of the answers so far says fiction. That came from Latrice. So what do you think?
I'm going to agree with that. I do think it's fiction. I think that's a downfall of a lot of keto diets. And you can actually gain weight on a ketogenic diet with overdoing fat. I think it's maybe more beneficial the first 3 months when you're becoming fat adapted to have a bit of a higher fat content or ratio. But then I kind of like to switch to a little higher protein, less fat approach typically. But
Yeah.
yeah, I think you can overdo fat. Absolutely.
Yeah, absolutely. It's calorie rich. So although we don't really count calories traditionally, but when we had Amy Berger and she talked about weight loss stalls and ultimately if you put in too many calories of any substance, eventually you're going to gain weight. So there are points where you want to go ahead and be aware. And another thing that I liked about Amy's comments is that you don't want to get too crazy about this. Just keep it simple, eat real food, and keep the really what she says, keep the carbs low. And then the rest will take care of itself. So I'm totally on board with that approach. And those who have commented, we mostly got fiction. So for those who are keeping count so far, you're doing pretty good if you chose. So anyway, keto is dangerous and is bad for heart health because it can raise your cholesterol. Is that fact or fiction? Keto is dangerous and it is bad for heart health because it can raise your cholesterol. So you guys chime in. Let us know if eating all that fat is going to clog your arteries. And a lot of people worried about that. And even not just patients, folk in clinical care, they're still kind of thinking in those terms. And so I'll go ahead and let's go ahead and answer that question. What's your thoughts on that idea?
Do you want me to answer that now?
Yeah,
Or are we going to give the audience a little bit?
Yeah, you go ahead. Is it dangerous? And what would you say about that in terms of heart health in particular?
Yeah, so it is a huge mental change or I should say it's a huge mental obstacle to overcome because we have been told for so long that fat is going to cause cholesterol changes and it's going to give you a heart attack. But I'm going to say that's fiction. I have seen cardiovascular disease improve. And lipid profiles improve with a ketogenic diet. So definitely fiction.
Yeah, it's really weird. And I always tell people, by the way, shout out to Becky and Latrice and Jessica, Charlie. They all put down fiction. And Robert says cholesterol is vital for human health. And for all the guys out there, you better get some cholesterol if you want to keep your testosterone straight. I'm just saying. So it's a big deal.
It's true.
Right.
And for females, they need it for estrogen and progesterone.
Right. It's a hormone, right? It's
everything.
DHEA and all of that stuff. These are sex. They depend on cholesterol. So for those who don't know it, now you know it, as a famous rapper once said. If you don't know, now you know. So let me go ahead and move on to the next question. Will it make my gout worse? So if you eat a keto diet, is it going to make your gout worse? So fact or fiction? Do you think keto is going to make gout worse? And if you think so, you put that's a fact. If you don't think so, then put down as fiction. So I'll give it a second. And it's a very important question because we don't want to do anything that's going to cause harm, and if I'm predisposed, I think that I wouldn't want that. So I got nope, fiction is what I'm seeing so far. And with that, Doc, any comments on the gout question from your experience?
Yeah, and this is a tricky question. This could be a trick question because we can actually see an increase in gout flares initially. And it's not from a ketogenic diet necessarily. It's from rapid weight loss. And it's a reflection of what the diet was prior to starting a ketogenic or low carb diet. But then it decreases significantly. I'm going to warn people that have had gout flares that you might have be at risk. Although I haven't seen a study to back this up, but if we slowly decrease the carbs instead of going, from the standard American diet to 25 grams of carbs a day, if we slowly titrate down, that I don't see the risk of gout flares. Yeah.
Yeah, I was fortunate to have a patient ask this question, and I cheated because I had just learned something in school. And and what it did is it substantiated what you just said. The first thing they said, you want to be gradual, and if you're gradual, that's better. There is a little competition between those ketones and uric acids, as your kidneys are gonna probably favor the ketones versus the uric acid. So what happens when you're, what people don't understand is that you can be in ketosis and not have any urinary ketones because your body's using it very well. So when you first go into ketosis, you're going to be spilling a lot of ketones, and uric acid, they can't leave your body, so it may build up. So the key, either, some people just do gradualism, some people take a little bit more medicine. Either way, you do better ultimately with the ketogenic diet. And I think that my colleague is right on the spot with that. So let's go to the next question. I feel like I'm in school. So the keto diet can improve my fatty liver disease. It's called non-alcoholic fatty liver disease. Before we became fat, guys, it was just, alcohol that made our liver fatty. And now we have this non-alcohol liver fatty disease. So the question is, fact or fiction? Keto diet can improve my non-alcoholic fatty liver disease. And if you believe that's true, you say that's fact. If you don't believe it's true, you say fiction. So put that in the comments, guys, and let's see if we can continue to pass our tests. I have a test to study for on Friday, so I'm trying to get a little practice getting the right answers. And basically, I'm seeing so far we got Becky chiming in with a fact, and that sounds like that may be a decent answer. We got Robert chiming in, and Charlie and Latrice. We got a lot of facts. So let's see if we can get the professor here to comment on that. So what you think, Doc? You think that's the right answer?
Yeah, I think low carb can absolutely treat fatty liver disease, and it can do so very quickly. We've seen from reports from bariatric surgeons like Dr. Rob Cyrus that putting a patient on a low carb diet can reverse fatty liver disease within days, not even weeks, within days, which is pretty incredible.
Crazy. And I think as long as us fat eating folk, particularly carnivores like my friend here, when you eat fat, you become a fat burner. So, and our body loves to burn fat from vital organs first. So let's go to the liver and the pancreas and burn that first. And it looks like we got a lot of facts. We got Becky, Charlie, Robert, Latrice, and Stanley and Darnell. Shout out to Darnell. He's a guy who I know really, he has his own little kind of weekly show, and he's going through his diabetes journey. So he shares his journey with people. So shout out, he's basically doing what we're doing. He's just doing it from a patient perspective. So I just wanted to do a shout out to here, and Omar Pierce wanted to do a shout out to you, Dr. Baier. So
thank you.
So directly to you.
I'm flattered.
Right. So let's go to another question. Keto will worsen my gallbladder disease if I eat all that fat. Keto will worsen my gallbladder. So if you believe that keto will worsen your gallbladder disease by eating all that fat, you say fact. If you don't believe that's true, you say fiction. So let's see if we can get some feedback. It says, if you were to cut someone open, can you tell if it's a fatty liver by looking at it? Interesting question. So what you think? You think you can look at that liver and tell it's a fatty liver?
Oh, yeah. And you can tell based on the size of it. Absolutely.
Yeah, it's a pretty, I think one of the, I have to say I don't know how cultural this is, but I'm going to say it. So when I was in medical school, and we were doing physiology, and we were cutting the pig who was sedated, but not deceased, I saw intestines, right? So I grew up where chitlins were like, you ate chitlins with the hot sauce and all of that. And I did not eat chitlins for quite a bit. In fact, because I don't think my brain understood I'm eating intestines. I just did. And I know historically why it happened. You had to eat what was left, whatever you could get. But man, I tell you. So yeah, if you look at that liver, you will see a fatty liver. So I think so for those who answered the question, I guess the next question, I'm going back to the old question. So we get a lot of fictions about this gallbladder question, Doc. Pretty much everybody, Becky, Harriet, and Latrice, and Robert, and Tracy, they're all saying fiction, as well as Grateful Keto is the name. You gotta love that, right?
Yeah.
Tell me what you think about that gallbladder, doctor. Any thoughts on whether or not keto will worsen, the fact that it won't worsen a gallbladder disease?
Right. So anytime you have rapid weight loss, if it's from keto, if it's from a high carb, low fat diet, if it's from starvation, you do have an increased risk of gallbladder disease and gallstones, particularly cholecystitis. But that's not specific to keto. Again, any rapid weight loss can cause that. And it's a reflection of what your diet previously was, very similar to gout. But keto itself absolutely does not put you at risk for gallbladder disease. And actually, you can see it improve. And there's also, there was debate for a while, if you've had your gallbladder removed, can you eat a high amount of fat in the diet? And we're seeing, yes, you definitely can. Just because you've had your gallbladder removed doesn't mean you have to stay high carb forever. You can absolutely do a low carb, high fat diet.
Absolutely. I think and particularly as we think about the folk who are, you want to train your family how to eat the right food, and the gallbladder is going to make biliary acids to help you digest cholesterol and fat. And it's important that if you have a regular consumption of fat, your gallbladder is constantly working to squeeze out those acids. Imagine if you don't have a high fat diet, and it's just sitting there, it becomes sludgy and it forms stones. And so, if you got stones sitting in there and you add this dietary change, those stones may then be liberated. But the key is, if we eat a high fat diet, we can keep our gallbladder working. So absolutely on the same page with my colleague here. So let's go to alcohol question. I got a lot of people in my family that want to blame it on alcohol.
That sounds right.
Yeah, that's about right. I think we all do, right? So let's talk about alcohol. This is the question, guys. Alcohol consumption will help keep me in ketosis. Alcohol consumption will help keep me in ketosis. So is that a yes, a fact, or is that fiction? Will alcohol consumption help keep me in ketosis? So I want you guys chime in. Give us your thoughts on that. Whether or not we're going to blame it on the alcohol tonight. We may have to go to YouTube and listen to Jamie Foxx, and I think T-Pain was the rapper. And we're gonna blame it on the alcohol tonight. So let's see if anybody has the courage to. So far we got Ohio's Best Peach. What's it? Another interesting name, said fiction. We got Tracy Jones doing a little laugh saying fiction, and so it looks like we got a few fictions coming up. I think no fiction. So we got some fictions. They're saying that alcohol consumption will not keep me in ketosis. What I'm hearing. So what's your thoughts, Doc?
You actually might register ketones after drinking. That can absolutely happen. I would not recommend that as a way of getting into ketosis or staying into ketosis. But yeah, you the way alcohol is metabolized and it interacts with glucose, you actually might register ketones after drinking.
That's right, absolutely. And what I tell patients is that, in fact, the diet doctor, I know I push them a little bit, but because they're a great resource. They do have some low carb alcohol options. So for those who like a little Chardonnay probably at this hour, There are some Chardonnays that you can consume. What we don't want people to do is to go into this lifestyle and think that they're missing out on something. You're not missing out on anything. I got literally in between takes, I threw something in the oven, and it's going to be some steaks tonight. I love steaks, by the way. I'm sure you do.
Oh,
too.
yeah, very much.
Right?
Yeah.
And then I'll throw something. But, we want to have fun, guys. So you can blame it on the alcohol and still be keto and not run into trouble. So, but yeah, as Carrie Stone King suggests, beer can be high in carbs, but they do have the light versions. But a lot of my patients say it's like drinking water, so they they don't like it. So let's go to another question to keep the party going. And another question that's very important, and I think people really need to hear this one: ketoacidosis is not dangerous. Ketoacidosis is not dangerous. Is that fact or fiction? Ketoacidosis is not dangerous. So what you guys think about that? Let's see if the problem with this question is a lot of the patients, or they may not be medical, and that term may not be familiar to them. But if you are familiar with it, just give us an answer. And Becky threw in, she had a little courage and she went with fiction. We have Harriet throwing in some comments saying fiction. It's a little bit of a trick question, so another fiction. So we got a lot of fictions coming with this one. The question is, ketoacidosis is not dangerous, and that says fiction, which means they think that it is dangerous. So what you think, Doc?
I would agree with them. Ketoacidosis is different, but let's distinguish it from nutritional ketosis, which is what we're trying to achieve.
I was hoping you would do that.
yeah, right. I mean, there's even clinicians and other doctors out there who still don't understand the difference.
I know, it's so true. And I've been shocked when people look at me funny. I'm like, it's not the same, but go ahead.
Yeah, no, that's it. Ketoacidosis, we see it more commonly in diabetics, but especially type 1. It is a state of most of the time where you have high sugar levels and high ketones. We are seeing some cases of what we call euglycemic ketoacidosis when patients are on a specific type of diabetic medication, the SGLT2 inhibitors. Not commonly, but we definitely, if you are diabetic, you are on medications, I would highly advise working with a doctor that knows about a ketogenic or low carb diet to safely get you off of your medication before implementing it to reduce the risk of ketoacidosis. But for the general population, you're not at risk.
Well, if you think about, you got two docs, obesity trained, and who promote this diet pretty much every day. And I've never seen anybody have a dietary ketosis that made them sick. In my training, when I'm not in the hospital much, but in my training in the hospital, those were some of the sickest people in the ICU. And we were on pins and needles, making sure we took care of those folk who had that problem. But dietary ketosis is very safe and actually good for you. So let's go to another question. The question is, fasting is not required to do keto. Fasting is not required to do keto. Is that fact or fiction? Do you have to fast? A lot of people that do low carb, high fat, carnivore, they fast a lot. But the question is, do you have to do that fasting to really do this keto well? And that's the question. And let's see if we get a couple of thoughts on that. I learned about fasting after I made dietary changes. It was something that kind of snuck up on me. And so far we're getting fact. We got Tracy and Jessica, and of course Grateful Keto. I mean, they got to chime in, and they are all saying fact. We got Carla throwing in a fiction, and that's kind of what this is all about. We can kind of discuss it and see what makes the most sense. So go ahead, Doc. Give me your thoughts on the question. Do you have to be in the fat? Do you have to fast to do keto? effectively. What's your thoughts?
I must say fiction. You do not have to fast to do keto effectively. I find patients naturally start fasting because their hunger is controlled. They're less hungry. They're burning their own fat stores for fuel, so they don't feel the need to eat as much as they did on a standard American diet. But you can absolutely do a keto diet without fasting.
Absolutely. I agree 100%. So, and again, I think that you probably are going to end up doing fasting because you're not going to be hungry that often, but it's not required. And I know people, I'll tell them, don't eat breakfast. They say, I like breakfast. I say, eat breakfast. It's not that big of a deal. It's like they're doing well. They, do you. Food is one of the most enjoyable things that we experience. So let's enjoy it. Let's experience it. So when you're having your Chardonnay, you can have do both, right? So it's all good. So another question that comes up, the keto diet is easy to adjust to. The keto diet is easy to adjust to. Is that fact or fiction? So for those who have tried it, you probably have an opinion about that. For those who haven't tried it, you probably have an opinion about that. So tell me what you think in the comments. The keto diet is easy to adjust to. If you think it's easy, say it's a fact. And if you think it's hard, I want to hear fiction. So what I'm seeing so far is looks like we got fact popping up, fact. We got a lot of facts. Ohio's best Pete showed up again. Becky showed up. We got Clayton. So let's we got fact. But we got one fiction. That's from Walker, John and Odessa Walker. They're doing it together. So what's your thoughts, Doc, in terms of that question?
Yeah. So I think, again, what your diet previously was can really determine the answer to this question.
Yeah, that's right.
If you are eating a lot of processed food, high carbs, and you don't slowly go into a ketogenic diet, you just one day cut your carbs dramatically, it might be rough. you might get some lightheadedness, some weakness, some fatigue, sometimes nausea. A lot of it's from electrolyte disturbances. But if you've already had a healthier diet that was that high in processed food, or if you slowly reduce your carbs to get into a ketogenic state, it'll be a much easier transition.
Yeah, I agree. And as you listen to my colleague answer, a lot of this is nuance. There's no right or wrong answer. Sometimes it depends on and you used the term during the podcast. You said bio-individuality. You were being really fancy. And could you explain what bio-individuality means?
Yeah, of course. So everyone is different, right? We have the same physiology, but we've skewed it along the way with our lifestyle choices. And then there's different genetic variations and things. But what works for one person does not necessarily work for the next person. What your individual experience is probably not going to match someone else's. They might have some similarities, but there's so much variance between people. We call that bio-individuality.
Yeah, I love it. Latrice Foster, she said it was easy to adjust for her. And she said, and that's why it's individual. She did intermittent fasting with the, she has the 16-8 primarily, and sometimes 20 hours. I think that's the warrior fast, but she lost 57 pounds and keeping it off.
Wow.
Latrice,
good job.
Shout out to Latrice for sharing that word of inspiration. And then I have mind-blowing health and wellness with Violet. I love that. I found jumping from a SAD diet was easier than the slow progression that many people I know. So she found that was, and then another, Charlie said that he had no side effects going from the SAD diet to the carnivore diet. So, you just got to love that. So,
yeah.
I like meat, so I'm a little bit of an omnivore. I do eat some vegetables, but you guys are pushing me. You're pushing me.
I'm telling you, keto's the gateway to carnivore.
Yeah, I'm definitely going to have a little bit of experiment. Here's another question: keto works best on a low protein, high fat diet. Fact or fiction? keto works best on a low protein, high fat diet. Let's get some thoughts on that one. And the big takeaway on this one is a low protein diet, part of this whole way of thinking. And so let's get some comments going with that. I think, these questions are to just help you think a little bit about it. For some who are in the dietary low carb space, these, we're preaching to the choir. But for those who are new to it, it's a lot of new information. And what I found, and you probably have found this too, Doc, is a whole lot of folk that you think will know some things they just hadn't heard, because the messaging outside of this community is quite different. And so and that's partly why we're here on an evening, is to get that message out for folks. So far what we got is we got Carla saying fiction, Charlie saying fiction, maybe Becky fudged a little bit, and then Grateful Keto said fiction, and we got one fact coming from Ohio's Best Peach. So, what's your thoughts on keto works best on a low protein, high fat diet? How would you answer that?
I'm going to bring up the bio-individuality again, but I will say my experience, I don't like low protein. I like moderate to higher protein. I feel like people do better with that. They retain more muscle mass while they're losing weight. And it's just my personal experience. I think it's very easy to overdo fat.
Yeah.
So, but to each their own. I mean,
yeah, that's right. Yeah. And I think the main thing is this ideal of protein. If you're carnivore, clearly it's not going to hurt you. So you're eating a lot of protein. Most people who go keto keep their protein similar to what it was, and then they just increase the fat and reduce the carbs. So you need protein in general. And so if you're going to reduce the carbs, you're only left with protein and fat. So you can't go too low with that as well. You just be eating all fat. And I'm not sure I want to go that far with it. So I think that's fair. And we'll go to the next question, and we'll do a few more. I just want to get some more in. The best number of carbs to get into ketosis is less than 20 carbs. The best number of carbs to get into ketosis is 20 carbs. So that's one of those interesting, nuanced questions. So if you think that's true, give me a fact on that. If you think that's fiction, let's go with fiction. So 20 is the number to get into ketosis. Let's get some thoughts on that. We got some folk chiming in. John, he's going to go with fact on that, and we'll see if we get a few more before we respond to it. We got Becky chiming in with a fact, and we got folk on. John was on Facebook, and we got Becky on YouTube, and we got some others like Carla on YouTube chiming in. And then she said fiction because she thought it was 50. Darnell said fact all day. He kind of went strong with it. Charlie said 20. I'm getting a lot of facts for this one, and it's they said the lower the better. That's a good answer. So what's your thoughts, Doc? 20 is the number that's best, and let's hear your response. I think I know what you're going to say.
Yeah, it's a recurring theme here. Bio-individuality.
We need to change the name of this segment. We're just going to put bio-individuality.
Yeah, right. I think a lot of people, well, it depends on their comorbidities and things, and age and hormones and what their diet was before. A diabetic is probably going to need to go down to 25 grams of carbs. A young athlete who's working out all day could probably get away with 75 grams of carbs and still be in ketosis. So again, it's the recurrent theme here is individuality.
And for those who are not familiar with Dr. Eric Westman at Duke, he would use terms like, what's that term he uses? Like, if therapeutic ketosis, right? So he would say, if you're treating seizures, you want to be very low and stay low because you want to keep those numbers stable. I'd say I've seen reports that say half the people at 50 carbs will be in ketosis, and nearly 100% at 20. At the end of the day, it's bio-individuality. If you don't know that term, you're going to know it today. Everybody is different, and you want to, and that's why me and my colleague, when we're on the podcast, we said, if you're a vegetarian, it's working for you, go for it. You do what works for you. We just know that what number I said, 88% of Americans are metabolically unhealthy. And the best diet for metabolic health, based on Dr. Feynman, my previous guest, who's an expert biochemist, he said was carb restriction. So again, that's why we kind of lean in that direction. And let me see what the next question is. The best fruit to eat on keto are citrus fruit. Fact or fiction? The best fruit to eat on keto are citrus fruit. So let's see what our participants are going to do today. Don't be shy. Go ahead. Nobody's going to tell on you. We're just friends. It's just us on, all over the world, by the way. I sometimes get people on YouTube. They're from England and Switzerland, and it just blows my mind. So,
oh, wow.
It's a beautiful thing to see. So we got fiction. Shout out to Carla, who threw in berries next to her fiction. And then mind-blowing health and wellness said, another trick question I get in lore is better. Oh, they're talking about the previous question, I think. So what you think, Doc? Citrus fruit. I'm trying to go keto.
Yeah.
I was told by the USDA that I got to eat fruit all day long. So
right. Yeah. So in general, citrus fruits tend to spike glucose levels higher than other fruits and have a bit more carbs than, say, berries. I like berries. But again, it's a bio-individuality. And this is where a CGM can be really helpful too, to see what it's doing to your glucose. Some people spike.
Explain what don't. Make sure they know what a CGM is.
Yes. So CGM, continuous glucose monitor. The Freestyle Libre is probably the most common because it's the most affordable right now, but it's a sensor you put on the back of your arm that tracks your interstitial glucose levels. So you can trend your glucose response after you eat certain foods. For example, if you were going to eat an orange or some pineapple or some berries, you could then check your glucose without having to poke your finger, usually through an app on your phone or a reader, and get real-time feedback as to how your sugar is reacting.
Yeah, great test, and we need to do better with coverage for that, but in terms of paying for it. But I agree, the technology is incredible, and now some of them will probably allow us to see that data from our patients while we're in the office and they're at home. So we want to take advantage of that. So thank you for bringing that technology up. And I'm going to go into your world a little bit and ask the question: it's okay to stay on keto or carnivore long-term? Fact or fiction? Do you think it's okay to stay on keto or carnivore long-term? If you think that's true, put fact in the comments. If you're not comfortable with that, because some large organizations have suggested that's not a good idea, you put fiction. So let's see, fact or fiction, long-term. Not just today, not just after you lost 20 pounds. 5 years from now, you're still eating like an animal, a carnivore. You're a wild animal. So let's see what we get. So far, we're getting some answers, and it looks like we are getting, let me make sure I got the right question. Fiction. Well, I take that back. That may have been a previous question. Fact. So everybody's saying fact. I see a question about somebody put Clayton put grapefruits, and then we got Darnell, my diabetic guy, saying fiction. So what you think, Doc? Can you eat keto carnivore long term? I'm not sure if you're going to tell me bio-individuality.
It crossed my mind.
Friday, listen, on Friday when I take my test, every answer is going to be Bio-Individuality.
Yeah, you can't go wrong with that.
That's right. Okay. So
You're going to ace it.
That's right.
Yeah. So, I mean, truth be told, we do not have long-term studies on ketogenic and carnivore diets. The best that we have is some 10-year studies from, or it might be a little bit longer, but epileptic pediatric patients who were on this long-term. With my understanding of the physiology and the biochemistry, I think personally it is safe to be keto or carnivore long term, as long as you're appropriately managed, right? And we do worry about vitamin and mineral deficiencies with a carnivore diet. I'm a big advocate for nose to tail from that perspective. But there are plenty of people who have been full carnivore, eating only ribeyes for over a decade, that are thriving and doing great. Yeah. So, I mean, from a medical perspective, I always want to keep an open mind and really evaluate the literature that's out there. And we don't have long-term carnivore studies. Sean Baker is raising money right now to do long-term studies. It's very hard to do nutritional studies. No one wants to fund them. But I've been doing keto for over 3 years now, mostly carnivore. I plan to stay this way. For me personally, I do not have any concerns about it, doing a diet like this long term.
That's right. And I feel the same way. And again, Sean Baker, if you look him up and you want to give $5, $10 to his research, because we need research, guys. There's not a lot of money for their drug companies won't sponsor this study because they're not making a drug, right? So we need to almost grassroots help support the research so we can help heal people. A lot of people are not doing well. Even if you think about Monique Travis, who was on the last podcast, I mean, she healed from 5 chronic conditions within 9 months, just doing keto, intermittent fasting, and exercise. So that's the real medicine, guys. And I really appreciate your comments, because that's what we need to do. So I do have a question about muscle mass. So I can gain muscle mass on keto. Fact or fiction? I can gain muscle mass on keto. Some people worry about that. Some people think it's a good thing. Some people think it's not a good thing. Athletes have to ask this question. Guys who don't, who want to kind of stick their chest out. I'm working on that, by the way. I just want to say that.
I can tell.
Right. I'm not sure how to take that. But
I mean, you're
who I get jealous of is Dr. Ken Berry, because I'm like, well, this guy is a pretty good guy, so I'm gonna have to. I'm glad we're doing everything virtual right now, so gives me more time.
Right.
Let's see what we got. Some feedback for that question. I can gain muscle mass on keto. Is that a yes or a no? Fact. Absolutely okay. Ask our paleo ancestors. Carrie.
Good response.
So I like that. And then fact, already past 2 years. I got fact all the way down. Various folk kicking it in. So, oh, wow. Robert Collins, 3.5 years keto, lost 75 pounds.
Awesome.
Killing it. So, wow. And then Carrie makes a good point. Stone King, you got to get adequate protein, though. Okay. So what's your thoughts about keto and muscle mass? What's your thoughts?
Yeah, I think you absolutely can build muscle on keto. This might be an argument for adding in some carbs around workouts strategically. You do need a bit of an insulin response just to maintain muscle mass and stimulate muscle growth usually. Adequate protein is very important as well. But yeah, you can definitely build muscle on keto. You definitely can.
Yeah, and I know I can tell you from personal experience, I joke about this muscle thing, but it's hard. Like when you're doing keto and you're trying to gain muscle, it's harder. But it's not, but you feel so good that you tolerate that. I'm not trying to be on a Wheaties box. I just want to be healthy. Now, I don't mind getting on a Wheaties box one day, but the point is, I want not a Wheaties box. I'm thinking about that's a grain right now. I can't do Wheaties, but shout out to all the Wheaties people. But I'm just not looking to get on the box anymore. So I think that's a good answer, and I think that you just have to get adequate protein. So I like those comments that our friend put in the comments. So real quick, it's rare to have keto flu when you start a ketogenic diet. In other words, it's rare to get keto flu when you start a ketogenic diet. If you think that's a fact, put that in as a fact. If you think that's fiction, put that down. So you just want to, people feel bad, they feel fatigued, they feel tired, and all of those types of symptoms. Is that rare or is that common? So if you think that is a rare thing, you're going to put down that that's a fact. So give me your thoughts on that, and let me see what we got coming in. I just want to say that I appreciate you guys. Anytime you're asking for engagement, you never know. I didn't know if you guys were going to be sipping on that wine tonight or joining us, but I appreciate we have a nice live audience tonight, and I appreciate that big time. So far, I'm seeing fact. So that seems to be the answer. So it's rare to have keto flu when starting a keto diet. Now, I already know what you're going to say on this one. We've been there, done that. So you think it's doctor? What you think?
Yeah, I'd say I wouldn't say it's rare, but I'd say most people do not experience the keto flu.
Yeah.
There's an adaptation phase, right? You might have a little more fatigue and your body's adjusting, but it's not anything like the flu.
Yeah, it's not. And I didn't have it at all. I have patients who are like, probably need to talk to Joan Iflin about, processed food addictions, because for them, it's like their body's like, what just happened? But when you transit, we were like vegetarian, then we went, kind of in a, keto. And then, so what happens is your body had a chance to kind of adjust. You didn't go from a SAD diet, a standard American diet, straight to a carnivore. There was an adjustment. One comment that was right on point was the Grateful Keto stated that, yeah, it's fiction, but if people use electrolytes, it would be fact. So that was very nuanced. In other words, and for those who don't understand, you may be getting rid of magnesium, potassium, sodium when you're in ketosis. So you have to put those things back. So I appreciate learning from the audience, sharing that message to help support our message. So just a couple of more questions and we're going to wrap up. I should expect to have low energy when I start a ketogenic diet. It's kind of a similar question, but I expect to have low energy when I start a keto diet. So let's see what people will chime in with that. Are you expecting to have low energy, or are you expecting to feel phenomenal at the gate? So let's see what people have to say about that. And I'll provide that. And so far we got, if I'm pronouncing it right, it looks like Theophilus, but Theophilus or Theophilus man said fiction. And we'll see if we got a few more. And that's what we're dealing with so far. So from your perspective, Doc, should I expect to have low energy when I start a keto diet?
I think most people do have a little dip in energy the first week or two, but then it rebounds incredibly and you have more energy than you ever did on this. Yeah, on your standard American diet. So
yeah, I agree.
Kind of like it gets worse before it gets better, but
that's right. And it is such a great feeling. And but again, when your primary fuel was one thing, you change it, it's going to make you feel some kind of way until your fuel tanks, until you become kind of a hybrid car. And now you can use both types of fuels. So I think that's absolutely correct. This is the second to last question. It says it's best to never cheat on keto. Some people cycle in and cycle out of keto. So the question is, fact or fiction? It's best to not ever cheat on keto. If you're going to do keto diet, you got to do keto diet. That's what the question. So is that fact or fiction? And we'll give them a moment to chime in, and then we'll wrap up with the final question. And I really like this format because it allows us to kind of poke fun at it a little bit while letting people kind of interact. So I appreciate everybody who's being involved in this process and just enjoying the interaction. We got mind-blowing health and wellness saying, fact, eating healthy is the answer. We got Sherry Denise Howard saying, fact, and Grateful Keto Fiction, you have to live your life. I like that. Right. Gotta love
Absolutely.
that. Other comments. So your thoughts, doctor, on cheating on keto. Are you allowed to do that?
Yes.
Circumstances when you should.
So I do think the first 3 months or so while you're becoming fat adapted, you should not go off plan. And then after you're fat adapted, you have a little bit more metabolic flexibility, you've repaired your insulin sensitivity, then there's a little more leeway. But I do think it's a slippery slope as well, especially when we're dealing with people who've had a food addiction. Sometimes just one meal can make it very hard to go back.
That's right. That's what Joan Iflin would say. And for those who are not familiar with Joan Iflin, she did a episode. She is the processed food addiction author, and she literally wrote the diagnostic criteria. So if you're not sure if you're processed food addicted, you should read about her work and get her support. It is true that if you are processed food addicted, you probably want to stay in your ketotic zone. Many people that I support certainly become metabolically flexible. And again, you know, my car outside, it only takes gas, but if I had a electric portion of it and I could use either or, it's much easier to do that once you've kind of giving yourself, like the doctor's suggesting, a chance to adapt to this. Your body gets used to using ketones, but it still remembers how to use glucose. So it'll be able to go. But so I think that it's okay to have your cheat days if that's who you are. But if you're addicted to processed food, you should probably stay away. So the last question is, men and women tend to have the same ability to adjust to a ketogenic diet. So it's about a man and a woman. We're trying to have equal rights for everybody.
Absolutely.
You know what I mean? We want everybody to be equal, but when it comes to ketosis and the keto diet, men and women tend to have the same ability to adjust to the keto diet. So if you believe that's true, you put fact, and if you don't believe it's true, you put fiction. And let's see if we can be equal when it comes to this topic, or if we have to be a little metabolically flexible in that regard as well. And God knows we all are made a little differently. So I'll give it one more second, and then we'll kind of wrap it up with that. And so far, I see fiction. Then I have Carla. That's Becky. Carla said fiction can be more challenging for women due to hormones. Guys can't say that. The only
yeah, that is true.
That came from a woman, you know what I mean?
Even if they're thinking it, don't say it.
I can't say it. We got a few others. Fact, men lose faster than women. That's from Grateful Keto. Even all women are different. Yep. So let's go. What's your thoughts on that idea, men versus women?
Well, based on my clinical experience, when we have couples that come in, the men do lose weight faster. That definitely happens. But they eventually stall and plateau, and the women catch up. So there's a lot of factors in there. Hormones definitely do play a role, but both can adapt just fine. The energy levels match each other usually, the sleep, the mood, all of that. The weight loss just seems to be slower with the females.
Absolutely. And that's been my personal empiric experience too, that there may be more challenges. And so I do agree that word that the other person said was probably accurate, but
yeah,
so it is true. So, you know, that's a great, and that's why it's good for us both to be here as well. So that was a nice session. I want, on behalf of the folk who participated, on behalf of myself and all the people who see this, I want to thank you for giving me a lot of your time tonight just to spread the message. And I think for those who are not aware, you're practicing virtually both in Illinois and in California. Would you wrap up with how
Yeah.
people can connect with you if they decide they want to learn more about this whole low carb from a clinician more directly.
Sure. Best way to reach us really is through our website, which is lowcarbmdsandiego.com, or you can find me on Instagram and Twitter at Doctoring Keto is my handle for both. So I'd love to connect with you guys.
Absolutely. And again, we know each other through Twitter and just being in the low carb community. And in fact, that's probably where most of my guests come from. We did talk about bringing some vegetarian to the show so they can kind of share their opinions as well. But this is all about continuous growth, guys. It's about, am I going to be better tomorrow than I am today? And can I learn something today that'll bless my family tomorrow? So this is what this is all about. I appreciate all of you for spending some time with us tonight. The podcast today is Tuesday, so that'll be another, probably on the whatever day that is on Friday, the 18th or whatever, 19th, it'll be there. And you'll see more of my guests talking in more detail about her journey. So thank you for being with us tonight. Have a great evening, and we will do this again next week. Take care.